It's a lecture that comes with a health warning. As should skiing and snowboarding, but it doesn't. So the lecture will contain very, very little technical material, because we're all used to giving very, very sort of technical and surgically orientated talks. And so this evening I decided to drop all that and give a talk with a more kind of wholesome slant to it. So the lecture is going to have no boring, complex classifications of exotic injuries which you can sustain whilst skiing or snowboarding, and there's going to be no detailed technical tips on just how we do our operations and the type of approaches one would use and the types of fixation devices that we use and the pros and cons of locking and non-locking plates and nails and screws, because I actually don't think that's very interesting for you. And there's going to be, well, really no gory slides. So if you're shocked or disappointed, now is the time to leave. Well, there might be one shocking slide, just to get you in, because I'm not a orthopedic surgeon. So first of all, do any of you ski or snowboard? What proportion of the audience? One of them. Well, it's actually easy to count the people who don't. Gentlemen there, you don't. You're part of a very large group of people in England. These are figures taken from the last snow sport analysis from the Ski Club of Great Britain that collects such data, really for the tourist industry and people providing facilities and equipment in the ski industry. And they analyse the data that comes in from various sources, and there's about 1 million people in England who ski and snowboard. But actually, it's down almost 40% over the past 5 years. So the ones of you who do still ski and snowboard are obviously the elite rich. Take my hat off to you. The average stay of people is about 7 days. It's expensive. You all know it's expensive. Average cost, 730 quid for a 7-day skiing. That's excluding the lift pass, the equipment hire and the ski school, and also all the equipment that you have to enable you to ski, so the kit. And it's a huge industry, about £500 million in the UK. Did you realise it was so big? Not curiously, it's enormous. Worldwide, it's estimated there's 20 million skiers, 200 million skiers, and 70 million snowboarders. You could almost ask who doesn't ski. You know, it's almost an exclusion factor in Northern Europe. And there's about 60 million visits to ski resorts in the US and Canada annually. So you can imagine the volume of work that doctors get from injuries that come off the slopes. 88% of skiers ski in the UK, ski in France, Austria, Italy, Switzerland and North America. However, just over 1 in 10 go to other places. Why is that important? Well, I put it to you, it's important because actually in some of these places the standard of medical care may not be as it should be. Now, people don't take that into account when they book their holiday, but quite frankly, given the risks involved, it is a consideration. Now, you might have read in the papers, some of you, that North Korea is planning to develop a ski industry. Have you read about that? No, there was it wasn't the papers, and I think it was a Swiss firm had been employed to provide the ski list, but they pulled out because they suddenly realised that although there was a lot of money involved, probably North Korea wasn't the best place to be partnering with. So they're looking for another partner. So potentially you could also go to North Korea eventually. Now, question: is skiing and snowboarding dangerous? And if it is, what are risks? Who thinks it's dangerous? Hang on, hands up really high. I do want to count this. 1, 2, 3, 4, probably 2/3 of the audience. other third of you, can I just ask, throw it out there, somebody who didn't put their hand up, why don't you think it's dangerous?
Well, I think it depends on the risks that you're willing to take when you're skiing.
That's a good point. Do you think that skiers and snowboarders mitigate risk?
Depends on if it's before or after lunch.
That's a very good point, which I will come to. Okay, well, my answer is I don't know. I spent a bit of time trying to find out exactly what the risk is, how dangerous is it, and I don't know, because actually you've got to dig around for the figures. They're presented in some confusing way, and it really doesn't give you a clear picture. Well, it doesn't give me a clear picture of exactly how risky this all is. And there does seem to be a dichotomy between the published statistics and numbers in terms of risk and what I see in the clinic. And I'll give you some examples. Accurate reporting for ski injuries is actually really difficult because people do it in a faraway land, in a faraway place, where a lot of the time records aren't often kept of the people attending, the people on the mountain. Some places do it really well. Some places in America have got good statistics. Other places which you'd like to have statistics from, they don't. And they do it via numbers or using a questionnaire or the number of hospital visits. But often people will have an injury abroad and then come home and only present to a doctor at home. So they're lost from the statistics. There's variable reporting from country to country, and I think it's incomplete. And there's a point of the treatment being local or just really diagnosed and fixed up when they come to home. So it really, is it dangerous? Well, it depends who you ask and what your view of risk is. Cui bono? There's also, I'm not great on conspiracy theory, but why isn't safety and so much of an issue with skiing and snowboarding? You have to ask yourself. It's a huge industry, and it supports lots of vested interests. People who produce the equipment, the manufacturers, the tour operators, the airlines, the hoteliers, the resorts, and the local medical centres. They benefit hugely from it. They're not going to tell you how dangerous it is, surely. So if it's dangerous, what are the quoted statistics? I think this is going to be gone into a little bit further this evening in another talk, but the risk is measured in an odd sort of way. It's measured in the number of injuries divided by the number of skiers' days times 1,000, which is, you've just got to get your head around that. And that's how it's produced in most of the literature. It's a very kind of abstract, woolly sort of idea. So what they say is 2 skiers will require medical attention for every 1,000 people skiing per day. Saying that seems quite low. 3 to 5 snowboarders. Snowboarding is clearly more dangerous than skiing. So if it's a 2 in 1,000 risk, acceptable. Yeah. Okay. It's probably the most dangerous thing that most people will do during the year for the condition that they're in, the circumstances that they're in, the experience that they have. How dangerous it is depends on your attitude to risk. There's about 1 in 140 risk of a hospital attendance, and it's said about 1 in 3,000 risk of the wrist fracture in a snowboarder. I find that remarkably low. I find that ridiculously low, but that is the published figure. Because if you speak to most snowboarders have in some way injured their wrists. So that's why I say there seems to be a dichotomy between published figures and personal experience. And it's estimated about 500,000 people are injured in US and Canada annually, and there's about 80 deaths per year in the US and Canada. If you look at the figures, people will say, oh yes, but in France, 80 people per year die as a result of drowning in their swimming pools. So it seems to qualify the risk and try to put it in perspective. when you're skiing, often speed is of the essence, and it's probably one of the fastest unprotected things that people will do during the course of the year. So how fast can you go? Well, the fastest man on a snowboard was, I believe, Darren Powell, who scooted down Les Arcs in a sort of red cling film suit in 1999 at 126 miles an hour, which is pretty damn fast. Ordinary mortals don't get to that. The average is, even if you're going fast, 25 to 40 miles an hour, which is still pretty fast, though you don't appreciate it, because the average driving speed in London is 10 miles an hour, and look how many accidents happen. So, question. Why do motorcyclists wear protective clothing? Any ideas? Answer on the board.
I don't.
You don't? Yes. But you're stupid. Well, they wear it to protect them from sustaining an injury if they crash. Yeah? Now, I don't think that the same philosophy is true in people who ski or snowboard, because you have a crash helmet when you're on a motorcycle going at 40 miles an hour, don't you usually?
Never go at 40 miles an hour.
Exactly, because you're in London, but even 30 miles an hour.
126.
Okay. But you have a crash helmet, yeah? You have a back protector, you have something on your shoulders to absorb impact, etc., etc. So, why don't most skiers and snowboarders wear protective clothing? Because I believe the vast majority of them believe that they are indestructible superheroes. And when you're skiing and snowboarding, most people don't have an idea about mitigating risk. They will do many things that will be objectively contrary to mitigating risk, because it may impact on their enjoyment of the experience, perhaps, or they lower their defence mechanisms. There are also very, very few rules for what you should wear, other than, I believe, in North America, where you do need to wear a helmet. And they don't want to wrap themselves up in cotton wool. So, if you are an fearless, invincible superhero, and actually you don't want to mitigate risk, and you really do want to enjoy the experience of skiing and snowboarding, what you should be doing is, please don't get fit before you go. Not a good idea. Don't practice on a dry ski slope, because you may be proficient on the slopes when you get there. You should borrow ill-fitting and worn-out equipment. Good idea. You should wear jeans. Anybody seen people on the slopes with jeans? I have. You have. Yeah. Is that sensible? No, they get wet. And they're really uncomfortable. I've done it. Don't do it. Not a good idea. My friend at the back there, observation. Get drunk and party every night, and then catch the first ski lift in the morning. Yeah? If somebody said to you, you're going to go on holiday and for 7 days you're going to play a game of football in the morning, game of football in the afternoon, yeah? So that's intense sport, for instance. But the night before, you have to go out, you have to get drunk, you have to party to 2 o'clock in the morning. You think they were crazy. You would never do that. But you would if you're going skiing and snowboarding. And you must also make sure, to enjoy the experience, you go on runs way above your ability. And don't forget to ski in poor visibility, or assume that you're just as good as you were last year. Make sure you forget your goggles, so your eyes sting in the snow. Make sure you must at least on one occasion ski off-piste without a guide, or even better, in an avalanche area on your own. Don't dodge the trees. Make sure you go through a forest, it's really exciting. Have a few beers on mountaintop at lunchtime. It improves your performance. And of course, don't wear a helmet, wrist guards or backpack. Can I just ask again, straw poll, who wears a helmet when they ski? About half the people who put their hand up to say that they're skiing. If you're going at 30 miles, well, if you're going at 25 miles on a motorcycle, do you think it's sensible to wear a helmet? Nods of approval. If you're going at 25 miles on a ski slope, do you think it's sensible to wear a helmet? That's why there's a disparity between what people believe is appropriate protection and mitigation of risk, and what they actually do. Don't bother with snow sport medical insurance. Don't need it because you're not going to get hurt. And make sure you ski in countries with fundamental healthcare systems. And I shan't embarrass myself for saying which countries they are. But if you're the first to ski in North Korea, you may experience that. So you'll be safe because you are a superhero. What sorts of patterns of injury do we see? Well, actually, there's an interesting parallels between skiing and snowboarding, but there are some differences. As you probably know, skiing lower limb, predominantly knee, which is why David's talking about ACLs and redo ACLs. Skiing, the other predominant injury for many skiers is actually head injury, hence wearing a crash helmet, and also injuries to the spine, less so. They do have some upper limb injuries, but not so much. Snowboarding, though, it's half of the course. Most people will, at some point, have an injury, a sprain, a bruise, and falling over. 45% wrist injuries. Head injuries also predominant. Fortunately, I think most snowboarders these days are sensible enough to wear some sort of head protection. And injury to the spine, some of them do wear back protection as well. So what sorts of upper limb injuries, I'm an upper limb surgeon, do you see? Well, you just see everything. There's nothing pathognomonic as far as I've ever experienced or I've read about, which is entirely characteristic of either skiing or snowboarding as far as the type of injuries they sustain. It will be everything from dislocated shoulders, proximal humeral fractures, AC joint dislocations and sprains, elbow dislocations, ligament injuries, distal radius fractures, scaphoid fractures. You see the whole panoply of injuries, and even the injury that's called skier's thumb, ulnar collateral ligament injury of the MCP joint. The last two I've seen, which happened in the past couple of weeks, one chap fell over in his bathroom, and the other lady fell over at a society wedding in Cannes. So it's not pathognomonic of skier's thumb. It's just a label somebody has simply stamped on the injury. Snowboarding. You can say a few things about the patterns of injury with snowboarding. It's often blokes in their 20s who statistically are at risk, and the quoted risk, whatever that means, is 0.28 per 1,000 snowboard days. That's, again, 3 per 1,000, or 1 per 3,000 snowboard days. 95, it's estimated, these are I think are wildly speculated figures, it's estimated. There are 95,000 wrist fractures a year. Who knows? Who goes around the world counting wrist fractures from snowboarders? I have no idea, but that's what's published. In other words, it's once in every 1,135 snowboarding days you may injure yourself, i.e. you probably can have 140 week-long holidays before you hurt yourself snowboarding. And if you extrapolate all of these figures into reality, it seems to me that it often hugely underestimates the risks that are published. I think it's much, much higher. People tend to fall backwards, heel side more often than forwards, because the ball goes from under them, I'm told. Teenagers have greater risk than adults, and there seems to be a gradation of the type of the pattern of injury between novices and experienced, as you'd expect. Novices, they have low energy injuries, so they'll have very often straightforward displaced fractures, not comminuted, not complex. Low energy, sort of simple fractures. Experienced snowboarders do more. They'll jump, they'll do turns and twists, and they'll land from a height, and all of that opens them up to having high energy injuries, and the pattern of those injuries is quite different. They have complex fracture dislocations, comminuted fractures. The stance seems to make a difference. You tend to fracture your wrist on the side opposite to the preferred direction of stance. In other words, if you have your left foot forward, you tend to break your right wrist. It's a pattern of fracture that's been written about. What about wrist splints, protective clothing? Useful. Most people don't wear them still. And the types of splint they wear are often harvested from skateboarding days. where where the splints are very, very short. They have a metal strip down the front. They're rather like Futura splints, and they're pretty inadequate. There's a certain reluctance amongst a lot of snowboarders to wear splints, even though statistically it reduces the incidence of distal radius fracture and severe injuries by about 50%. And don't know why people do this. Usually they come around to the idea of wearing the wrist splint after they've had an injury, and not before. They think they're bulky, they're not trendy, they don't need them because they're too experienced to warrant that sort of protection. In actual fact, the more experienced you become, the more more complex and difficult snowboarding tricks you may wish to do, the more at risk of worse injury you are. But it's not seen that way. There's a very good one on the market called the Flex Meter. You can get it off Amazon. I think it's about 30 quid. Have no interest in the company, but it seems a very good design. And I'm told it works well from people that I've recommended it to who've gone off and used it in snowboarding. So, in order to prevent injury, what should people do in all seriousness? Well, it does help to wear wrist guards. It helps to wear a helmet as well. It's helpful to learn how to fall to prevent too bad an injury. You need to respect the conditions, your ability and other people on the slopes, and they don't stop on the fall line if people are whizzing past you. Thank you.